Hi, I'm Dr. Jocelyn, lead pelvic floor physical therapist from the Vagina Docs.
And I'm Dr. Jordan, lead chiropractor. Thanks for taking a moment to join us today.
We understand the responsibility you carry as OB-GYNs. You're not only guiding patients through some of the most important moments of their lives, but managing a variety of challenges, like helping patients navigate pregnancy discomfort, preparing moms for the unknowns that come with labor and delivery, managing any complications along the way, plus postpartum recovery. Your work is vital and often complex.
At the Vagina Docs, we see ourselves as an extension of your care team. We're here to provide an added layer of support. Many of the challenges your patients encounter, like pelvic or back pain during or after pregnancy, urinary leakage, or difficult labor and delivery, are often linked to pelvic floor dysfunction, a main area of our expertise. Our goal is to equip your patients with the tools they need to prepare for smoother deliveries and faster postpartum recoveries, so that they feel more confident and supported throughout their journey. Today, we'd like to share how we address these issues and why encouraging your patients to start pelvic floor physical therapy during pregnancy makes a meaningful difference for your patients and for you.
Many of the expectant mothers that we see, whether they have issues that they want resolved or they're seeing us to help prepare for their delivery, lack awareness of how to properly engage their pelvic floor and core muscles. This engagement is critical for stabilizing the pelvis and spine, supporting continence, allowing relaxation for full bladder and bowel emptying, and elongating the pelvic floor during delivery. What we often see is patients who unconsciously contract their pelvic floor muscles while pushing, creating strain on the pelvic floor and creating resistance against uterine contractions. This is why it's so important to address these issues before or during pregnancy rather than waiting until after delivery. The stronger and more prepared their pelvic floor and core are during or going into labor, the better their recovery, even if tearing occurs.
Another common issue is poor breathing mechanics. The majority of patients we assess often breathe into their upper chest. The shallow breathing pattern limits pelvic floor and abdominal movement, leading to excessive muscle tightness, poor coordination, and reduced stability. It can contribute to pain, increase labor difficulty, and even heighten the risk of birth injuries.
Lastly, many patients present with pelvic floor inflexibility. This is often due to poor coordination, breathing mechanics, or even underlying factors like gut or nervous system dysfunction. Without proper flexibility, the pelvic floor cannot easily adapt to stretch required during childbirth. To address these challenges, we've developed a comprehensive approach that focuses on optimal core and pelvic floor muscle function, breathing, and flexibility. For pelvic floor and core engagement, we begin by assessing how our patients currently use their core and pelvic floor. This allows us to identify strong, dominant areas and underdeveloped ones. Using our proven method, we systematically train these muscles across all primary positions and movements they do and use daily. This includes tailored exercises and practical strategies for their lifestyle. For delivery-specific needs, we assess how their pelvic floor responds during a push. If the muscles tighten rather than elongate, we work in phases to teach proper elongation and techniques to build intra-abdominal pressure without tightening the pelvic floor. By delivery, most patients can elongate their pelvic floor fully, reducing the risk of injury and improving outcomes.
For breathing mechanics, we start by building awareness of proper diaphragmatic breathing and progress to targeted exercises that integrate these techniques into daily life. For delivery, we teach both relaxation breathing and breathing techniques to help with effective pushing. This is essential, as improper breathing during delivery can lead to increased pelvic floor tightness and a higher risk of severe tears. Recognizing that endurance is critical, we implement training programs at different stages of pregnancy to ensure patients are prepared for the demands of labor.
For pelvic floor flexibility, a core part of our third trimester care is direct pelvic floor stretching, particularly through myofascial release, which we've found highly effective for improving flexibility. For patients who are uncomfortable with internal techniques, we offer alternatives like hip stretches, breathing exercises, and nervous system relaxation exercises. This work not only addresses existing flexibility issues, but also prepares patients for the significant stretch their pelvic floor will undergo during delivery. It's not uncommon for us to include partners in this process, as it helps the moms feel supported and helps the partners feel more engaged in the process.
Our ideal patients are those who are proactive. value their health, and want to be engaged in their pregnancy and delivery process. The best outcomes are seen in patients who start their therapy during pregnancy and follow through with all 3 phases of care. This includes bump to birth to prepare for delivery, pelvic floor reset to recover post-birth, and strong as a mother to rebuild strength beyond pre-pregnancy levels. These patients not only experience smoother deliveries, but also report faster recoveries and greater confidence in their postpartum health.
For you as their OB-GYN, this means fewer complications during delivery, smoother postpartum recoveries, and more satisfied patients who feel empowered and supported throughout their journey. By partnering with us, you can trust that your patients are receiving comprehensive care that complements and enhances the outcomes of your work. At the Vagina Docs, we believe every mother deserves a strong, supported pregnancy and postpartum journey. We would love the opportunity to collaborate with you, providing additional resources and expertise to complement the exceptional care you already offer to your patients. Thank you for your time. We look forward to partnering with you to bring even greater value to your patients and your practice. For more information, scan the QR code to revisit this presentation or schedule a one-on-one meeting with us.